Well, thank you, Mr. Chairman, and thank you to our witnesses for being here today to discuss this important issue of transparency and healthcare pricing. You know, there's so many issues in our healthcare system, and we've talked about several of them today, but there's no one solution necessarily that's going to solve all of them. You know, what you need for emergency care, what you need for planned procedures, what you need for preventive care, all different. And what we have to recognize is that some of those solutions do solve some of the problems, and it can't just throw them out because they don't solve all of the problems. Last week, we learned that inflation had gone up again. Americans are now paying 15.3% more than they were when President Biden took office for the same goods and services. And in a lot of medical procedures, that's even higher than what it was a little over 2 years ago. We know what prompted this rapid increase in inflation: massive federal spending. So while Kansans have had to watch their spending habits, Democrats in D.C. have pushed out over $11 trillion in spending, which has brought us to the limit that the federal government can borrow. As they struggle to stretch the same dollars to do more, Americans have a right to know how much the doctor is going to cost them. As we look for ways to curb federal spending and bring the federal deficit under control, we can look to a growing body of evidence that suggests a link between price transparency and reductions in federal health care spending. Healthcare spending currently represents 18.3% of our GDP. 1 out of every $4 the federal government spends is on health care, and that figure is projected to rise to at least 35% over the next decade. Premiums and deductibles in private plans are rising more than wage growth, and Medicare's Hospital Insurance Trust Fund is projected to be insolvent in 2031. These numbers are troubling. But the data shows that increased healthcare price transparency could help reverse the trend. If transparency results in a 1% reduction in cost, that could eventually lead to a $4.8 billion reduction in federal spending over 10 years. Mr. Kansan, if these transparency rules were improved, what are the economic outcomes and what can we expect to see in terms of costs for high-cost services?
So specifically, which set of rules?
Well, in terms of as we put in more rules around having transparency around especially providers and...
Yeah, great. So I'll just give you an example. A retail client of ours, a patient requiring a joint replacement, received a $150,000 joint replacement. This isn't 15 years ago, it's not 20 years ago, this was in the past year. This hospital was in the lowest 20% of all patient outcomes in the United States for hospitals that we score that do joint replacements. There was a hospital 30 miles down the road that does the same joint replacement in the top 20% of all hospitals, and they're roughly $35,000. We have enormous differences in price and in quality for these services. Being able to navigate and being able to align the benefit design so that we reward patients for using high-value care and discourage the use of low-value care has a huge opportunity to save not just for the employee themselves, but also for the employer plan sponsors. When we look at this data, there's been a lot of discussion so far today. Roughly 40% of the total spend for any given employer could be shopped. Within that spend, easily half of that spend could be saved. So there's a significant amount of money that's on the table. What I'll say is over a 20-year period, we've seen utilization of our tools grow and utilization of those higher value providers increase, enabling those employers to incrementally grab more of that savings that's sitting on the table. There's a ton of savings that's still there. I think that's the opportunity that's in front of us through the ability to price more of these services and align the benefit design with what we want, which is better value.
Yeah, I mean, you know, as we've talked about, at the heart of healthcare is people, yet ironically, healthcare is one of the few systems where individuals don't know the price of services that they receive. Dr. Whaley, while the hospital rule has shown some promise, we know that not all hospitals are the same. In Kansas, we have the second most number of critical access hospitals at 82 compared to only Texas at 85. Many critical access hospitals focus on getting patients stable and then moving them to larger medical centers that are more equipped to handle complicated cases. With compliance around these transparency rules so low, what considerations or resources are necessary to help some of these critical access hospitals come into compliance without being burdensome or one-size-fits-all?
I think even for critical access hospitals, compliance and posting prices for the shoppable service is important. When we've actually looked at the types of hospitals that are actually non-compliant, It's actually not many of the critical access hospitals, it's many of the large nationwide systems. And so it doesn't seem like it's a resource problem with compliance, but rather an enforcement problem.
All right, thank you, and I yield back.